We all know about the broken healthcare system in the U.S. The question is, how do we fix it? Well, at least the Virgin Islands senators have an idea, as they are supporting the president's health care plan. News Channel 8's Wes Small has the story.
Once again, we are with Senator Samuel Sanis, and today we're going to be talking about the senators and the fact that they have supported our president, Barack Obama, and this health bill situation. I can't tell you how controversial this situation is, but being the most powerful country on the face of the earth, I believe it definitely needs to be fixed. There's no excuse for citizens not having health care. The sad thing is that the way President Obama is being portrayed in the media and at these town hall meetings, Senator, and I am aware of your editorial that you put out last week. Congratulations to you. The insults.
Yes.
The insults that are coming to the president.
You know, Wes, it is embarrassing when I read some of these editorials and the way they are actually insulting our president. To me, it's a disgrace that people actually have stooped to that level. And it's such an important issue. Here we are, the most powerful nation in the world, and we have one of the worst healthcare systems in the world. We spend trillions of dollars in a war and where we're sending our daughters and sons to fight, yet we cannot spend money for our own healthcare. Here in the Virgin Islands, West, we have people that cannot afford to get a checkup, people that are dying of prostate cancer, people that are dying, ladies that are dying of breast cancer because they cannot afford it. We have elderly that actually skip their medication to make it last longer. Come on, what are we doing? We have to support President Obama. And I want to say for those individuals, especially those individuals that have written those editorials, there was one editorial that was written, I believe it was last week, that compared our president to Adolf Hitler. To me, that was such an insult.
You know, I want to stop you there, Senator, because I've been listening to some of the talk shows, looking at the town hall meetings, the C-SPAN and so forth, and they're mostly pockets of white, Caucasian, sour grapes. People, I hate to say that, and there are traces of psychopathic racism.
Yes.
And that's the only way I could look at it. It's psychopathic racism. Never before can you remember United States president, which were all white, being insulted the way the way that this man came out and said to President Obama. Rush Limbaugh saying before he even was sworn in, he said, "I hope he fails." We've had also someone who says, "I hope he gets brain cancer, death to his family, including his 2 idiot children." Senator, it's psychopathic racism.
Yes, and it is. But you know, the good thing about it is that it's only a small portion of the population, and that's what we need to keep in mind. For the most part, I truly believe that most people in the nation are for Obama. Most people
they voted for him.
They voted for him, exactly.
Yes.
So you know, there is no doubt in my mind that he's going to be successful, especially in this healthcare reform.
So now let's bring it close to home. This resolution that you and the senators unanimously passed, and I want to say the only vote that she wasn't there was Nellie Senator O'Reilly, and that's because she was involved with her toll scholarship.
Yeah, a toll fellowship scholarship.
Congratulations to her. Now, what happens to that document or that passage?
It's going to be sent, of course, to the president, to the delegate, and it's a support. It's a support. We're showing President Obama that our government, our first branch of government, is in full support of his measures.
I'm Wes Small for News Channel 8.
And how does the president's health care plan affect us here in the territory? News Channel 8's Wes Small shows us that the news is not good.
This is Dr. Cora Christian. She wears many hats. And this health care situation, Doc, is just getting more and more confusing by the minute. And our beloved President Barack Obama is certainly taking an unnecessary beating. Let's remember, this health care thing was broken for decades.
Right,
So,
right.
Doc, you warned us about this, by the way, as soon as it was coming out, that this is not a perfect plan. Now, since it's been talked about so much in town hall meetings, and since our senators here have now sent a resolution to Washington backing President Obama, what is your take on it, especially as a doctor?
Well, let me be really clear, because as I said on the National Board of AARP, there's some very specific things that we're asking for. And I want to separate that from what's happening for us in the Virgin Islands, because we're in trouble in the Virgin Islands. Let's talk about what's happening nationally. AARP, first of all, wants to make sure that anyone with a pre-existing condition will be able to get insurance. So our population is made up of people 50 to 64. That's the population that often has difficulty because they've lost their job, they've gotten sick, the insurance was dropped. That we want to make sure that regardless of what illnesses you've had, you'll be able to get insurance. That's one of the asks from ARP. The other one is that we're fighting to protect Medicare. We want anybody to touch Medicare. We don't want anybody to touch the relationship between you and your doctor. We want to make sure that medications are affordable. So we want to close what we call that donut hole, that coverage gap that's there. We've got several asks from ARP, and we're doing, I think, rather well. You never know with Congress, because when they go to the joint session, you never know in the joint conference what's going to happen. But, you know, ARP has been a strong force in making sure that they fight and protect Medicare, and that people who are our members, and they're fighting for younger people too, because they want it to be affordable. Now let's come back a little bit to the Virgin Islands, because in the States, the exchange is not an issue. All of the 50 states are going to be part of the exchange. But the Commonwealth of Puerto Rico and the Virgin Islands will not be part of the exchange. And therefore, the issue of affordability becomes a problem. People who have low incomes, it becomes a problem. They're not looking at parity for people who are Medicaid. Those are those who are, you know, unfortunate enough that they can't make a living to be able to pay for their health insurance, or to some extent they have certain issues that requires their workload not to be at the level. So therefore, the Medicaid is because of income. Medicare is because of age and disability. 65 years. Those people will get it because you paid into it. They can't deny you that. But for Medicaid, you can only make $5,500 a year with $100 of assets. We do not have equity. That's wrong. We're citizens. We fight in wars. They don't ask us at that time whether you were from the U.S. Virgin Islands or were from mainland.
Doc, why do they do that to the Virgin
I'm telling
Islands
you,
all the time?
So an ARP is fighting again for parity.
To you guys.
Parity, but we're not getting through. So we need to write, we need to petition, we need to ask people in different jurisdictions other than the territories, our friends in Atlanta, New York, and Florida, to write to their congressmen and their senators and say, look, we need to have parity for Puerto Rico and the territories.
And this is on YouTube, so you're watching it in the States. Come on, don't be jealous of us just because we're in paradise. We're suffering big time.
And the exchange is critical because the LIS, which is a low-income subsidy, will not apply to us unless we're part of the exchange. And I like to use it this way. Think about it this way. There's a grocery store that you want to go shopping in, and there's cereals all lined up there. Different kinds, different, you know, prices, but you can't even get into the grocery store because you're not part of the exchange. That's what's going to happen to us in the territories. We're not going to be part of the exchange. We've got to get that provision changed. So we need people to scream, yell, get up, petition, do everything to make sure that when this law passes, that we are part of that. Right. So I'm hoping that your viewing audience understands that, and everybody writes in and gets.
Let me tell you something. Thank God for the AARP. I really mean that. And Dr. Cora Christian, thank you too. You know, when you go to heaven, you got wings for you. I'm Wes Small for News Channel 8.
Government House was abuzz today. That's next. Stay with us on News Channel 8. Well, we finally have a confirmed police commissioner and a confirmed health commissioner. Let's take a look.
I'd like to bring forth Commissioner Francis for a few words.
The magnitude of the challenge before me to prevent and reduce crime in the territory is significant. Your long-standing support of the police department, which is evident in your budgetary inclusions and your approval of the staffing consideration as well as the administration's pledge of total commitment to our organization, is appreciated. There is a lot which is expected of me in this new position, but I'm not discouraged. You have my assurance that I will continue to advance every cause at my disposal to diligently serve and protect the people of this territory.
Now we'll have a few remarks from Julia Sheen-Aaron.
When I look at the territory's health status indicators, I am convinced that there is a need for additional local and federal resources in the areas of health promotion and disease prevention. This is another area where the territory is discriminated against, as many of our grants are based not on our poverty level or our per capita income, but based on our population.